Hello, and welcome to part 4 of urinary system anatomy. We'll begin this discussion by talking about some functions of the bladder. So the bladder acts as a reservoir for urine, and along with the urethra, it eliminates or expels urine from the body. Normally, some urine remains in the bladder at all times, but as the amount reaches about 250 milliliters, the desire to void arises. The act of voiding is known as urination and is normally under voluntary control. Another name for urination, of course, is micturition, and we'll talk about that again in a minute. The desire to void may pass if the bladder can't be emptied right away, as you know, but the total capacity of the bladder varies from approximately 350 to 500 milliliters. And as the bladder becomes fuller, the desire to void becomes more urgent, as we all know. If the internal bladder pressure rises too high, involuntary urination may occur. So a few terms to review. We just talked about micturition. Remember, that refers to the act of voiding or urination. Incontinence refers to any accidental or involuntary loss of urine from the bladder, so that would be urinary incontinence, or you could have incontinence in the bowel. So feces or wind can pass from the bowel involuntarily, and that would be bowel incontinence. Retention, number 3, is the inability to void, which may be due to an obstruction in the urethra or a lack of sensation to urinate. Finally, you feel the urge to urinate when your bladder contains approximately 250 milliliters of urine. And remember, the total capacity varies from 350 to 500 approximately. Truthfully, though, I have been in the emergency department when they have inserted a catheter in a patient's bladder who had retention, and they were able to drain 900 milliliters of urine from that patient's bladder. So certainly, while the normal capacity is up to 500 milliliters, we do know that the bladder can retain more urine when the patient is having difficulty voiding. Okay, let's talk about the male pelvic organs for just a minute. So remember, when the bladder is empty, most of the bladder lies right behind the upper margin of the pubic symphysis. So here's your pubic symphysis, here is the bladder. Okay? As the bladder fills, more and more of it rises above the level of the pubic symphysis. So remember, when the bladder is empty, it's kind of flat. As it fills, it kind of expands upward. Okay, you don't have to write these down, but let's just reference or review the male reproductive organs. So we have the testes, the seminal vesicles, the ejaculatory ducts, and the ductus deferens is included in that. The penis, of course, and the scrotum. The male urethra, so we'll point that out right here, extending from the bladder, extends from the internal urethral orifice all the way to the external urethral orifice at the end of the penis. And notice the urethra extends through the prostate gland and the entire length of the penis, of course. The male urethra averages 17.5 to 20 centimeters in length. I don't really need you to know that, but just a fun fact. And it serves two functions. Of course, it helps to eliminate urine, which is stored in the bladder, and it also serves as a passageway for semen. Okay, let's look at the female pelvic organs. Again, notice the position of the bladder, posterior and just superior to the upper margin of the pubic symphysis, so just behind and a little bit above. And as we discussed in the previous slide, depending on the amount of urinary distension, that bladder can rise upward again above the margin of the pubic symphysis. The female urethra is a narrow canal about 1.5 inches long that extends again from the internal urethral orifice to the external urethral orifice. And you can see that here. The single function of the female urethra, of course, is the passage of urine to the exterior surface of the body. The female reproductive organs include 2 ovaries, the fallopian tube or uterine tube, and the vagina, and of course the uterus as well. The urethra is actually embedded in the anterior wall of the vagina. So here is the anterior wall of the vagina, and of course there's our urethra. So let's talk just a minute about retroperitoneal and infraperitoneal organs just as a review. Remember, we learned this in the first semester. So the kidneys and the ureters are retroperitoneal organs. The bladder, urethra, and male reproductive organs are infraperitoneal or below the peritoneal cavity. And you can see the peritoneal cavity is outlined here on the female. So just kind of for your reference. The female uterus, fallopian tubes, and ovaries, however, pass into the peritoneal cavity. So the male reproductive organs are located below the peritoneum and they're completely separated from the other peritoneal organs. It's a closed sac in a male. However, in a female, again, you can see that the female reproductive organs pass into the peritoneal cavity. The lower aspect of the peritoneum, just as a review, is a closed sac in the male, but not in a female. Okay, last slide. This slide depicts the location of the bladder in relation to a fetus and the pubic symphysis. So here's pubic symphysis, here is our bladder, and then of course here is the fetus. The fetus puts tremendous pressure on the bladder, and you can see that in the drawing. The bladder is being compressed here. And that explains why pregnant women have to use the bathroom so much. All right, so this concludes our discussion on urinary system anatomy. Please don't hesitate to reach out with any questions you may have. Thank you.